All right, let's just jump right into this explainer. Today, we're stepping straight into a chaotic emergency room to explore that razor-thin, high-stakes line where medicine actually meets the law. Welcome to The Scales of Science. We're going to be unpacking the absolute foundational concepts of forensic medicine. This is a space where your clinical knowledge isn't just used to heal a patient, it's literally used to administer justice. It's incredibly complex and honestly fascinating. So, let's break it down.
To really grasp the gravity of all this, you've got to picture this scenario. The ER is an absolute madhouse. A 25-year-old guy is rushed in after a brutal road traffic accident. And look, despite the trauma team's absolute best resuscitative efforts, he succumbs to his injuries. Heartbreaking, right? So, a police officer shows up, hands the junior doctor a standard death certificate, and asks him to authorize the burial so the family can take the body home. The young doc, feeling totally empathetic, pulls out his pen, gets ready to sign, cardiopulmonary arrest due to blunt force trauma, but out of nowhere, the attending consultant grabs his wrist. He stops him literally right before the ink hits the paper, looks him dead in the eye, and whispers, "If you sign that, you're not just making a medical error, you are committing a crime."
So here's the profound question we need to ask ourselves. Why on earth is signing a standard death certificate in this specific scenario a massive medical legal violation? How does a routine piece of paperwork signed with the absolute best of intentions turn a well-meaning doctor into an accessory to evidence destruction? Just keep that in the back of your mind, because we are definitely going to solve this.
Now, to unravel our ER mystery, we've got a quick roadmap to get through first. We'll hit forensics versus jurisprudence, check out the subspecialties, look at how the field handles the living and the dead, break down the tripod of life, survey global systems, and then finally, resolve our opening case.
All right, Section 1, Forensics versus Jurisprudence, a crucial distinction. Let's start with a major pitfall. A lot of students and even seasoned attendings mix these two up. It's a classic trap, but once you see the difference, you'll never forget it.
The whole trick here is understanding the direction of the application. Medical jurisprudence, which comes from Latin for law and knowledge, is all about the laws that govern medical practice itself. Think ethics, confidentiality, informed consent, malpractice. Forensic medicine, though, totally opposite direction. That is your applied medical science being used to serve the justice system. So just to be super clear, if a surgeon messes up in the OR, that resulting malpractice suit, that's medical jurisprudence. But if that exact same surgeon is subpoenaed to examine a stabbing victim for a court report, boom, that's forensic medicine. The medical knowledge is exactly the same, but the way you apply it changes the whole shebang.
Moving on to Section 2, the subspecialties, beyond the mortuary. Let's use this to completely debunk the dead body myth.
Yeah, a lot of people assume forensics is just autopsies, but it branches out into practically every corner of science. First, you've got forensic psychiatry, evaluating criminal responsibility, like was the perpetrator legally sane during the crime? Then there's forensic odontology, and here is a great memory trick for your exams. Think of the ODO and odontology as resembling the circular shape of teeth, or orthodontics. This is the study of teeth and bite marks for absolute identification. We've also got forensic entomology, think insects, using insect life cycles on a cadaver to pinpoint the exact time of death, and of course, general forensic science covering chemistry, ballistics, you name it. So just picture a courtroom in your head, psychiatrist on one side analyzing the mind, dentist on the other matching a bite mark, and a bug expert in the back figuring out the timeline. It's an incredibly collaborative ecosystem.
Okay, Section 3, Living and Dead, Scope of the Work. Keeping that courtroom visual in mind, let's talk about the sheer scale of this field. It's built on 3 pillars: examining the living, investigating the dead, and upholding the law. And clinical forensic medicine, dealing with the living, is a massive part of daily practice. ER docs see this constantly with assault or trauma victims. And guys, there is an unbreakable rule here. If it is not written, it is not done. Every single scratch has to be meticulously documented. Actually, in some jurisdictions, like Sudan for example, you can't even legally examine an assault victim without a police requisition, usually called a criminal Form 8. Why? Because this legally protects you, the doctor, and locks in a strict chain of custody for the evidence. If you break that chain, say you forget to log exactly who took the DNA swabs at what time, that evidence gets thrown out. A literal criminal could walk free just because a doc skipped a signature on a handoff log. Crazy, right?
Section 4, the tripod of life, concept of death. Now, what happens when all our clinical efforts fail? We shift to thanatology, the formal study of the dead.
Here, we have to define exactly how life ends scientifically and legally. This brings us to somatic death. Basically, it's the death of the body as an integrated unit. Clinically, you certify this by the permanent, irreversible absence of heart sounds, breath sounds, and respiratory movement. But biologically speaking, how does the body actually reach that point of no return?
Well, this perfectly illustrates Bichat's tripod of life. Human survival totally relies on three highly dependent vital systems. You've got the brain, where failure leads to coma, the heart, where failure causes syncope, stopping the blood, and the lungs, where failure leads to asphyxia, stopping the oxygen. The pathophysiology here is absolutely critical. If any single one of these pillars permanently fails, the other two rapidly collapse. I mean, you can't have a beating heart without lung oxygen, or a working brain without heart blood. When that tripod breaks, you get somatic death.
Next up, Section 5, Global Systems, Medical Legal Systems. Once somatic death is confirmed, the resulting investigation looks totally different depending on where you are on the map.
This is a super high-yield pearl if you ever plan to practice internationally. Look at the qualifications required to lead these systems. In the U.S. medical examiner system, the head must be a qualified medical doctor. That guarantees really high-quality medical investigations. But in the UK coroner system, the head can be a doctor or a lawyer. And here's a huge pitfall to watch out for. In the Scottish system, the procurator fiscal is always headed by a lawyer. Because of that, they focus really heavily on the strict legal and administrative side of things, and they often have to pull in external medical specialists for the nuanced clinical stuff.
Let's also bring this right up to the cutting edge, because as of 2026, the tech is wild. We're seeing a massive push into digital forensics. We're talking medical cybercrimes, like bad actors maliciously altering electronic health records to cover up negligence. Digital forensics tracks every single keystroke. Also, get this, vertopsies, advanced 3D postmortem CT and MRI scans are literally replacing scalpels. It is a total game changer, especially in areas with strong religious or cultural objections to traditional autopsies, because it lets pathologists do their job entirely non-invasively. So cool.
All right, Section 6, the mystery resolved, the stroke of a pen. Armed with all this new knowledge about the tripod of life and legal boundaries, let's head back into that chaotic ER.
Remember our junior doctor, pen hovering over the death certificate for the 25-year-old car crash victim? The consultant grabbed his wrist for one very specific reason. A road traffic accident is medically and legally classified as an unnatural death. That's a broad legal category that covers accidental, suicidal, or homicidal deaths. It is absolutely not a natural disease process.
And under any global medical legal system, a treating ER clinician is strictly prohibited from issuing a standard death certificate for an unnatural death. The law says you must withhold that certificate and transfer the body straight to the mortuary for a formal medical legal autopsy. The autopsy determines the physics of the injury, not the ER doc. If that junior doctor had signed that paper, he would have completely bypassed the judicial system. He'd have illegally closed the case and actively destroyed forensic evidence. And yeah, that carries severe criminal penalties.
So here is your golden rule. Know your legal boundaries and leave unnatural deaths to the forensic specialists. The absolute biggest takeaway from this explainer is the immense legal weight of your signature. It is never just paperwork. You always have to ask yourself, in the crazy, fast-paced chaos of the ER, does a stroke of your pen serve justice, or did it just accidentally cover up a crime? That's all for today's explainer. Keep questioning, keep learning, and I'll catch you next time.